So, discussion, birth plan. Basically, for the birth plan, I would tell them to bring someone who they trust because it might be a doula or it might be their spouse or significant other. Doula, because sometimes they can help guide a pregnant woman to have the baby. Also, they can help maybe rearrange the mom, be an advocate for the mom, whereas a nurse may be like, okay, this is the way the hospital wants things to be done, so you have to have it done this way. I would also, if there are not any serious complications with the mom, go to a midwife station or a midwife hospital. I say serious complications because let's say the mom faints, or let's say there's serious blood loss, there's severe complications where the baby is born like feet first. That is something that the midwife might not be trained to do. So that's why I'm like, if there's no serious complications. Um, but yeah, that's what I would do. Birth plan, write down what you actually want. I would highly recommend also going to birthing classes to see what options are available and basically make an informed, educated decision with having a baby, because you don't know what you can do or cannot do until you actually have the baby, unless you are knowledgeable of what is allowed or is not allowed. Let's see, epidural. I would recommend no, but I would basically let them know like this stuff might happen if they did get an epidural. They may end up having back problems later in life because of the epidural. So I would say personally no, but I would say it's up to them if they want to go through it. However, I have heard at some midwife stations or hospitals, they actually have a pool and like almost like a swimming pool or a bath. What you do is that you get into the bath and it's basically like the natural midwife version of having an epidural. So it's a lot less painful, and for whatever reason it works. I was before against it, and then I found out that it actually is like a natural epidural, and I changed my mind because I don't have to worry about paying for that epidural. Do I think there should be a recording of the birth? No, because there's no way I'm going to show it to my friends and family. I'm not going to show it to like anyone else. But I do think it's a good idea to have it just in case there's any complications, to be like, hey, this is what's wrong. We have proof that it went wrong. If that's the case, yeah, I would want it, and then delete it if there's no complications, because I don't want to see that in the future. But yeah, there's birth plan.